Now to what could be a medical breakthrough, a big one right here in Western New York. Doctors are testing a drug that may be the first new medicine for type 1 diabetes since the discovery of insulin. News 4's medical expert Dr. Peter Ostro has the details.
The drug liraglutide, or Victoza, was licensed for use in type 2 diabetes a couple of years ago. It works very well at helping to control blood glucose levels.
You can see that these numbers are extremely good.
The way it works is different from other diabetes medications, and that gave Dr. Paresh Dandona an idea.
Looking at those effects, then we reasoned that the drug may well be effective in type 1 diabetics as well. And when we tried that, the results were dramatic. Within 24 to 48 hours, the fluctuations in blood glucose levels, as seen on continuous glucose monitoring, dramatically diminished.
Type 1 diabetics require insulin, and many of them receive it through an insulin pump. Dr. Dandona and his colleagues tested liraglutide on some well-controlled type 1 diabetics. Their control got even better. They required less insulin, and they lost weight. No other treatment had ever accomplished that.
So this is the first real therapeutic step beyond insulin in the field of type 1 diabetes.
He and his colleagues have received $1 million in grants so far to see whether the drug will work as well in a much larger group of type 1 diabetics. If it does, that better control of blood glucose levels will mean fewer complications of diabetes, such as heart disease, blindness, and kidney failure.
And if we can prevent complications, hopefully these people have a better quality of life and a longer life.
People with type 1 diabetes who are 15 to 30 years old are eligible to participate in this study. And if you want more information, call them at 887-4486. This really is exciting, and it's happening right here in Buffalo.
Oh, it's huge. My husband's a type 1 diabetic, so I can really key into this. He's out of that eligibility range. There are a lot of questions about a study, whether you're getting the actual drug or a placebo, though. How do you know?
Well, it's one of those kind of studies. The only way they can prove for sure whether the drug makes a difference is to have it blinded like that. But they should have an answer in 6 months or so, and if it works, then many, many more type 1 diabetics are going to receive this drug. It looks terrific.
All right, side effects?
You know, it's been in use for a couple of years already, and so far the only significant problem has been nausea, and that only affects about 1 in 20 people, so it really seems pretty harmless, and the potential is enormous.
All right, we know you'll keep us updated on all this.
Okay.
Thanks, Doc.